Hello, I'm Jen Pike, counsel in Alston & Bird's Healthcare Regulatory Group. My day-to-day involves advising healthcare clients like health plans, providers, and healthcare technology companies on compliant use of healthcare data, particularly under HIPAA. In this video, I'm going to provide a high-level overview of the key HIPAA issues that organizations should consider as they pursue data-driven strategies. When we talk about healthcare data monetization, one of the first things that comes to mind is the Health Insurance Portability and Accountability Act, or as it's more commonly known under its acronym, HIPAA. HIPAA plays a central role in healthcare data monetization because HIPAA sets the federal framework for how protected health information, or PHI, may be used and disclosed. PHI is identifiable information about an individual's healthcare or their payment from healthcare. But it's important to remember that not all health data is PHI. In order for health information to become PHI, it has to be held by a HIPAA-regulated entity. HIPAA-regulated entities fall into two categories: covered entities and business associates. Covered entities are those like health plans and healthcare providers, and business associates are the vendors that handle PHI of the covered entities when providing services to or for them. The general rule under HIPAA is that covered entities and business associates cannot use or disclose PHI unless HIPAA specifically permits that use or disclosure, or an individual has authorized it. That matters for healthcare data monetization strategies because if an organization's data involves PHI, the organization must either fit that strategy within an existing HIPAA permission or get an individual's authorization for that use of the PHI. In practice, getting a retroactive authorization for data that an organization already has is often impractical, if not impossible. So the key question becomes, is there a specific HIPAA permission that allows us to use the data in this way? HIPAA does include permissions that may support data monetization strategies, but it's important to know that that analysis is very fact-driven. At one end of the spectrum, a direct sale of PHI, meaning disclosure of PHI is in exchange for compensation. That's generally prohibited without express authorization from the individual. However, not all monetization strategies involve a literal sale of the information. For example, a hospital might use its own data, its own PHI internally to evaluate and create new service lines. That kind of activity falls under a hospital's healthcare operations. Healthcare operations are permitted under HIPAA without an individual's authorization or other type of consent. Importantly, though, this analysis changes when we move from covered entities to business associates. For business associates, the analysis is certainly more complicated. In addition to HIPAA itself, business associates are bound by the terms of their business associate agreements, or another acronym, BAAs. A business associate may only use PHI in ways that are explicitly permitted by its BAAs. While BAAs will always allow PHI to be used and disclosed, an example, for the services that the business associate is providing to the covered entity, it doesn't always allow broader uses, such as developing new products or service lines. While it's not common for a business associate agreement to include only permission to use PHI to provide the services, we have seen that in BAAs for our clients. If so, that hypothetical data monetization plan of using PHI to evaluate or develop a new service within the business associate wouldn't be permitted. Importantly, however, we do see that most BAAs include additional permissions, including a very common one called proper management and administration. That term isn't clearly defined under HIPAA, so whether a particular monetization activity fits within proper management and administration, again, depends on the details. If data is properly de-identified in accordance with HIPAA, meaning that either certain identifiers are removed or an expert has opined on it, that information, importantly, is no longer PHI, and so HIPAA does not apply and its restrictions don't apply. De-identified data can even be sold, a literal sale of de-identified information, without violating HIPAA. Covered entities can de-identify their own PHI without any permission or authorization from the individual. Business associates, however, may only de-identify PHI if their BAAs explicitly permit de-identification. Even then, what we're seeing commonly in BAAs these days is that even if there is a permission to de-identify, there will then be a contractual restriction on how that de-identified information can be used. It might say that you can only use the de-identified data to provide services to the covered entity. So a business associate could have de-identified PHI now, but be contractually prohibited from using it for its own uses, such as monetizing it. That's why BAA review is so critical. Because business associates are governed by the terms of their BAAs, any monetization plan involving PHI requires a careful review of all applicable BAAs. Now that can be a significant undertaking, especially for vendors with many covered entity clients and years of legacy data. BAAs may vary widely, be outdated, or even be inherited from acquisitions or predecessor entities. Even after reviewing the BAAs, business associates also need to ensure that they can operationally segregate data they are permitted to use, ones where their BAAs allowed de-identification, and those that they can't, the BAAs that told them they cannot de-identify information. Given these challenges and the burdensome review of BAAs, some organizations actually choose to update their BAAs proactively. We often see that when there is another business change that provides an opportunity to update the BAA to obtain clearer permissions for future data strategies.